Okay, hey, my name is Mickey. I'm here to help you with setting up your CPM. When you receive it, you're going to have actually the CPM itself, power cord, the pad kit, which we have over here to the side, and you're going to need a tape measure. First things first, you want to plug the machine in. So you have a power cord. It's just going to plug right here. Sometimes it's a little tricky to get it, but it just pushes in. And then also down here is actually the power switch. So the first thing we're going to do is measure the patient. And we've already measured Russ, so we know he's at 15 inches. But you're going to measure from the middle of the knee to the bottom of the hip. So we got Russ measured here, and then we'll set that to the side. In order to have the correct length from the knee to the hip, there's numbers that correspond with the amount of inches that your leg is. So in order to change that, you loosen these knobs, and you can move it up if you're taller, way down if you're short, but we'll put it at 15 like we had for Russ. So we put it at 15. Next thing we've got is to get the correct length from the knee to the bottom of the foot. So we're going to go ahead and loosen these knobs, and it's going to allow us to slide this piece in and out. Typically what I do, we'll go ahead and take one of these straps and we'll strap it around here. This strap is actually going to stay in that place. And then we'll take the other strap and it's going to go here. And obviously you're going to need another person to help you with this. Just thought I'd throw that in there. So you'll sit down into the CPM as Russ is doing. And your knee should line up with this fulcrum because that's where it's going to bend, and that's where we want your knee to bend. And then we'll bring this back to the bottom of the foot and tighten these down. And that's how we get the length correct from the knee to the bottom of the foot. So now Russ can jump out, and we'll get the rest of the pad kit set up for you. This is the foot wrap. It's got a little lip here. Just fits here. There's a Velcro base. Fits on the back of the foot pedal. These are just Velcro straps. And they are going to wrap around the frame and to itself. You want this to be in the middle, so you can't make it too tight until you find exactly where you are. And we'll just make sure that's there. This leg strap will go back on, but for now we're going to take that off and set it to the side. And then we're going to start with the cover. It's going to cover the frame, make it a little bit more comfortable for you to sit in the CPM. Again, more Velcro straps that are going to connect along the frame. You actually start with this end as the top, so the ones that are closest will go up here. So we'll just undo this and this. And it is a lot of Velcro, so it is very sticky, so you are gonna probably, be attaching and detaching, and it does get stuck on itself sometimes. We'll find another one, and we'll just go around the frame. Come down here. Same thing here. This is also not an exact science. It does not have to be absolutely perfect. as far as putting this cover on, So that's just the tail. If you're really tall, you might use up all of the tail. Okay, so when you go to get into the machine, your foot's gonna set up against the foot plate. It's just gonna hold you in place. So this strap then will go around the thigh, and it will just hold you in the correct place, as the machine is working. So we're getting into use. So here's your remote. This pretty much controls everything. Once you have your the frame set up to your height, that should not have to move anymore. And it's basically start and stop. So start and stop. But there's a couple other things I want to show you. So right now, the 70 is where the flexion is currently set for. Flexion is the bending of your knee. So it's the bend upward. 70 is pretty aggressive. So we're going to go ahead and bring that down. And we'll tap this arrow that's pointing right up at the 70. And then we'll use the plus and minus arrows. Let's go ahead and bring that down to 50. And it'll blink a couple times and then it'll stay steady when it's set. Right now, the 10, which is the extension, which is the straightening out of your leg, it's fully extended right now to 10. That's pretty good number to start with. And that degree is measured along the fulcrum where the machine is bent here. Where should I set this at? Where does my doctor want me to start? So typically this is something that is done to your tolerance. We want to push it but not cause pain. If you're causing pain, you're going too you're going too hard for your body. So we're going to go ahead and push start. And what's going to happen is this machine's going to move up to 50. So this, would be a 50-degree angle right here. You'll see this number is going up, up, up. That's where your current angle is. So now it's going down as the machine is going down. It's going to go down to 10 and then back up to 50. So like I said, we do this to your pain tolerance for ACL patients and total knees. You do not want to move this more than 5 degrees per day, and that's in both directions. So tomorrow, this 10 might go to 8, and the 50 would go to 53. So that's a total of 5-degree span. You do not have to go 5 degrees. It could be 2, it could be 1. Like I said, it all depends on how you feel and your pain tolerance. Like I said, we want to push it, but we're not causing pain. The other thing I'd like to show you is the speed button. You can set the speed. It's set through 1 through 5. So what we do is we tap this speed button here. It's just below the start button. So right now it's on 4. So maybe on the day of surgery you're going to start at 1. And that is super, super slow. Again, we're not trying to cause pain. We're just trying to have you move your leg, get some blood flow into the area. The first few days, what I tell my patients is it's not about repetitions, it's about time. So this is to be broken up however you would like in 6 hours a day. So you can do an hour at a time, 2 hours at a time, 3 hours at a time, or the 6 hours all straight. As long as you get 6 hours in per day. And more if you'd like, it's not going to hurt. And then, so right now we're on 1. As you can see, it's moving very, very slowly. So eventually you may want to kick that up, and it goes up to 5. So I'm going to show you this fastest speed. This is as fast as it goes, which is really not super, super fast, but and just a couple of typical little tips. It's easier to get in and out of the machine when it's on its lowest point. So we're going to stop it when it gets to 10 so that the patient can jump out easier. The other thing is, whatever leg it is that you're having surgery on, it's always easiest to lead with the surgical leg. So we have Russ's right leg in here, and so you would get into the machine from this side, so you don't have to lift the good leg over and then put the bad leg in. So always lead with the surgical leg. If you have any other questions, your rep can help you. Just reach out to him. There should be his or her number in your package, and they'll be happy to help. Thanks a lot.